Lectin exposure can create a disconnect between cellular energy status and blood markers, leading to a false sense of metabolic health. So you go to your doctor and say, I'm not feeling right. The doctor asks, are you eating beans? Are you eating wheat? Are you eating anything that has lectin in it, right? They don't know to ask for that as a general rule. They're not trained that way. And that's what it is. So we're looking for a new diagnostic model, a paradigm shift, right? Multi-layered, contextual, and root cause aware. You still do the biochemical testing. Fasting insulin, HOMA-IR, C-peptide, fasting glucose, free fatty acids, beta-hydroxybutyrate, BHP, right? That's ketones. Uh, high reactive CRP testing, right? That's inflammation. Reverse C3 zonulin, LPS-DOA, that's leaky gut markers. I suggest all of those in a standard blood test to make sure where you're at. But you also need functional stress tests. You need postprandial insulin challenge. There are different ways of doing this, but you need to measure your glucose and insulin after you eat, not just after a 12-hour fast. Okay, how well are you handling insulin? How well are you working it? Right, disproportionate insulin spikes with flat glucose is an issue that probably is lectin related. Okay, free fatty acids during fasting or exercise. Uh, if you're not getting your free fatty acids properly and you're not keto adapted, there's something wrong. Once again, we look for at insulin activity, system pattern inventory, right? Symptoms within 60 to 120 minutes, right? 1 to 2 hours after eating. Fatigue, fog, cravings, anxiety point to a problem. Food specific triggers, nightshades, legumes, grains, right? Do these things cause you issues that you notice? Once again, that points to something. Energy crashes despite high ketone readings or stable blood sugar. Your energy should not be crashing in this case. That points to something. Patterns of gut symptoms with clean whole food meals. You're eating clean, yet you're still having gut issues. Something's wrong. Okay, and that's something that maybe normal blood markers are just not going to show properly. Okay,